Hello, my name is F.Paine, and I'm going to do a presentation on a simulation dissertation. So the objectives of this presentation are we're going to introduce Bai's dissertation, including her research topic and the importance of the study. We're going to discuss her methodology, her results, and any conclusions or recommendations that she had for further study. So the title of Bai's dissertation was Evaluation of High Fidelity Simulation with a Health Assessment Course. So she kind of takes us through the history of nursing education and simulation. And the way nursing education started was it was an apprenticeship model. Physicians took nurses under their wings and told them how to care for patients. And that went on for several years until Florence Nightingale came along and legitimized nursing as in its own particular specialty. Nursing education has continued through the years since Florence Nightingale to develop and for us to be autonomous as nurses, and especially in nursing education. And as we've developed and moved through, we've gone with an apprenticeship model where our students will follow nurses through the hospital, and that's how they'll learn how to be nurses. And that's just not working anymore. And we'll get to that in just a minute. And then the history of simulation is it's most known in aviation, but because it was so successful in aviation that medicine and nursing and all these health professions, including education, decided to use simulation to see if we could get those same returns with using simulation to help keep a safer environment. So Bai is looking at instructional methods in nursing education, specifically simulation, and if it can be used and is a legitimate means of educating nurses. And the reason why this is important is Bai completed this study in 2008, and a lot of the same issues still remain. So we have an aging nursing faculty, and they're getting ready to retire. And she cites Broome in saying that, we're losing more and more nursing faculty, and we're not keeping up with it. We also have a nursing shortage, which decreases the amount of clinical sites available to us because we don't have the nurses at the bedside to help provide that apprenticeship model. And at Bai's University, they had very low NCLEX pass rates. And this is significant because people who pass nursing school aren't necessarily registered nurses, and they may not be until they pass their NCLEX. So Bai was looking at ways that we could use simulation or something to help improve their NCLEX pass rates, their national licensure exam. So Bai's methodology is she used a quasi-experimental quantitative non-equivalent control group pre-test post-test design. And what she did is she had 3 different times that she tested. She did a pre-test prior to the content that she was studying. She also gave them a confidence survey, and then she did a post-test at the end of the content that she delivered and a confidence survey. And then a month out, she did another post-test and then another confidence survey. The sample size that she used was 51 junior level nursing students at one particular university. And she used 3 different instructional methods with these 51 students, and they were divided into these 3 groups of 15 to 20. She introduced the study, told them why she was doing this study, and then told them that there would be no effect on their grade whether they decided not to participate. So she used the respiratory content, and she had a traditional model, which is they did the content, they went to the clinical site, they worked on actual patients. And the issue being there is they can't always get the content that we want in the clinical setting. The second method that she used was they got the same classroom content, and then they used an actor or a standardized patient, and then evaluated after that. And the third model, they used a simulator. They got the same classroom content but used a simulator. In the simulator, we can actually manipulate breath sounds and respiratory pattern and all that stuff on a mannequin and kind of get the objectives that we want. So she performed this this module. And then she did all of the pre-test, post-test and the second post-test a month later, and all groups showed that they had increased knowledge, that they gained knowledge from this, and they had increased confidence levels. The big difference was there was a couple of statistically significant differences, and the first one was between the traditional group and the standardized patient. When she did the pretest, she found that there was some differences in how the initial group pretested. And the traditional group scored quite a bit lower on the pretest, so she did a one-way ANOVA to make up for that difference. And then when she did, she noticed that the traditional group scored a little bit higher. There was more knowledge gained than with the standardized patients. And the other statistically significant difference was in confidence level for the group with the simulator. There were some areas in confidence that they felt quite a bit better, and one of them was assessment. They felt like they had better assessment skills compared with the other groups as far as their confidence level and what the students self-reported. So this just helped solidify what I hypothesized, that using a simulator was an effective instructional method as far as knowledge gain, confidence levels, that it was an appropriate way to educate students. But I also had a couple of recommendations. She recommended first that we use the larger population. A population of 51 is very small when you compare it to all nursing students. She also recommended that we compare the difference between the use of two different simulators. She used a particular simulator, and she recommended that we compare and contrast if students did better with one simulator versus another. She also recommended studies using multiple scenarios with students at a variety of levels. She used first semester junior nursing students, and generally most nursing programs have 4-ish semesters, 4 to 5 semesters where students are considered nursing students. And so comparing the different gains as far as how confident they are using the simulators. She also compared looking at NCLEX pass rates in people who were exposed to simulation to see if there's improvement in how they did on the NCLEX, if this strategy was really effective, to see if it helped with retention, if they were able to do it on the simulator, and we could control that just a little bit more as far as patient assessment. So in conclusion, she looked at curriculum and simulation. You know, we can't just throw an expensive piece of equipment at students. We have to have this in our curriculum. It has to be developed appropriately, and it has to have objectives that we can meet. We need to look at simulation, how it can be used as a learning tool. Should we do it weekly? How often is this? And another important component is to develop realistic scenarios. Students who come into the simulation lab and we have such off-the-wall simulation that it's not really effective and it doesn't help meet goals, and they're like, well, it would never happen like this in the real world. They're not going to put as much time and effort into this simulation and make it as realistic as humanly possible. And these are my references, and thank you so much.